Hi, I'm Dr. Duffey. This is Sophie here, and this is the fourth video in a series of videos on how to get ready for college in trying times. This video is on new ways to hang out in college. Think of your current isolation as an opportunity. You can take the time on your own to get better at hanging out by learning more about popular culture, something you'll be talking about with other people. You could ask a good friend about how they manage social situations you found difficult. Learn from your mistakes, but don't beat yourself up or overanalyze. You're a growing person. You learn from your mistakes like the rest of us. Take the time you have with your family to practice your conversational skills, such as asking questions or looking for things that you have in common, being positive and staying open-minded to new ideas. I'm sure you've already played games together virtually with friends, met on Zoom and tried your hand at baking or discovered the Netflix party app. Now, stretch yourself to experience taking a friend on a virtual museum tour, or a virtual orchestra performance, or virtually view your local zoo's animal feedings. Listen to podcasts like the Brain Science Podcast, which is for everyone who has a brain. My new thing is the Buddha board, which you can find on Amazon. It costs about $10, and you paint with water. I have some words of warning about hanging out. You've heard many times that you need to social distance by keeping 6 feet from others, but you may not have heard that a cough or a sneeze can propel these very small COVID-19 viral particles up to 12 feet, and also that they can float in the air up to 3 hours. Being young is no guarantee, and even some young people end up in the hospital. Young, healthy professionals have died after being repeatedly exposed to high concentrations of the virus. And that's because of their work situation they're thrown into it. Some small children have become critically ill with inflammatory multi-system syndrome from the virus. Young people with lowered immunity, pulmonary disease, heart disease, significant obesity, recent major surgery, a history of cancer, high blood pressure, and type 2 diabetes are at risk for more severe effects from the virus if they get it. Different kinds of smoking can compromise your lungs. Sometimes a COVID infection can damage your heart, your pancreas, your nervous system, or your lungs. If you're in good health, you may have the virus with no symptoms. That means that not having symptoms does not mean that you don't have the virus. So you can transmit it to others, even if you're asymptomatic. You could infect a grandparent or infect your roommate who goes home and infects their grandparent. If 2 people are wearing masks, it can significantly reduce the spread. If one person is wearing a mask and the other is not, the mask is substantially less effective. When you see others not wearing a mask, they're saying they don't really care whether or not they give you the virus and your school sends you home. Other people wearing masks reduce the secretions that come from their mouth as well as from their nose. But masks can leak out their sides. That makes it more important to keep your distance and wear appropriate types of masks. You should be studying the types of masks to see which one makes the most sense. It's also essential to wear protective eyewear to reduce your risk of infection. You need to be able to identify COVID symptoms in others and in yourself. Not everyone has symptoms, and not every symptom is related to the virus. So some of the symptoms of different things are similar. you want to check out the CDC's list of symptoms on the internet. Finally, if you have risk factors for a severe reaction to having the virus, you should have a serious talk with your family doctor before you decide to go to college. Thanks.